Welcome to your roadmap to Medicare. Now, this roadmap was customized based on questions that you've answered, either by talking with our client services team or by going online and taking our online quiz. So what we're asking is, if you have friends or family that need guidance into Medicare, please have them either go online and take our quiz or schedule a consultation with one of our team members, because everybody's situation is just a little bit unique. And we want to make sure that people get proper advice specific for them. Because as we've discovered, there could be serious consequences for not enrolling in Medicare when appropriate or not choosing the appropriate coverage for yourself. So what we're going to talk about today is your roadmap. So your roadmap to Medicare is based on the fact that you are not covered by group health insurance. So maybe you're on an individual insurance plan, an ACA, Obamacare, maybe you have your own private individual insurance, or you're self-employed, or you simply just don't have health insurance at all right now. Well, in that case, you do need to enroll in Medicare when you turn 65. You're going to have a 7-month enrollment window to do it. It's called the initial enrollment period, and that is starting 3 months before your birthday month, the month of your birthday, and then 3 months following your birthday month. So during this 7-month window of opportunity, you can enroll in Medicare, and your effective date will be defaulted for you based on the date you actually enroll. So there's two situations for enrollment. If you are already collecting Social Security income, then there's nothing that you need to do to actually enroll in Medicare. You will be automatically enrolled, and you're going to get your Medicare card in the mail likely about 3 months before your 65th birthday. And your effective date is going to be the first of the month that you turn 65. But if your birthday is the first of the month, your effective date is actually going to be the first of the prior month. But if you're not collecting Social Security income, in order to enroll in Medicare, you have to go online and complete the enrollment form. And it's a simple process. It only takes maybe 5-10 minutes at the most. If you need help with it, we're happy to answer questions. We have step-by-step instructions on how to navigate the website as well. But depending on when you go online will depend on what your Medicare effective date is. If you go online the 3 months prior to your birthday month, so let's just take an example. Let's say my birthday's in March. I can go in February, January, or December. So starting December 1, I become eligible to enroll. If I enroll anytime during those 3 months, my effective date will be the first of the month of my 65th birthday. Of course, unless my birthday is the first, then it would be the first of the prior month. And then if I enroll during my birthday month, if I enroll in the month of March, my effective date will be the first of the following month, so April 1st. Where it starts to get tricky is in the 3 months following that. If you go online in the 3 months following your birthday month, your effective date is delayed. It's either delayed 2 or 3 months from the time that you enroll. So if you're trying to achieve a specific effective date for your Medicare, let us know, send us an email, give us a call. We can help you figure out what month you need to go online to try to achieve that effective date, or if there is even any possibility for achieving that effective date. Because of the delay, sometimes certain months are skipped and you won't be able to get an effective date during certain months. So we can certainly walk through your specific situation and help you figure out the exact timing on when to go online. Now, there are consequences to not enrolling in Medicare when you're supposed to. There's 3 main consequences. Number 1 being the penalties. So a lot of people have heard about penalties in Medicare, and this comes into play in your situation. If you don't enroll in Medicare when you're supposed to, you'll start to accrue a financial penalty that will be added to your Medicare premium later. So let's break that down between Medicare Part A and Medicare Part B. Medicare Part A, many people get at no cost, a $0 premium. And the way you get Medicare Part A at no cost is by either you or a spouse having paid your Medicare taxes for a minimum of 10 years throughout your lifetime. And if that's the case, Medicare Part A has no cost, and there's no penalty for enrolling late in Medicare Part A either. But Medicare Part B would carry a penalty. And Medicare Part B does have a cost, and we do have another video that talks about Part B coverages and costs. But the penalty for Medicare Part B, if you do not enroll when you are supposed to, accrues at 10% for each year you wait. So if you wait 3 years to enroll in Medicare, perhaps you didn't know that you needed it, when you enroll, they will assess a 30% penalty, add it to your Medicare Part B premium, and you will be paying that 30% penalty on each premium, unfortunately, for the rest of your life. So it is financially important that you enroll in Medicare when you're supposed to, so you don't accrue this penalty. The second consequence to not enrolling in Medicare would be lockout periods. So you have your initial opportunity to enroll, and if you don't enroll during that time, there's only certain times a year when you can enroll. It's called the general election period. And the general election period is from January 1st to March 31st each year. It's the first quarter of each year. That's when you'll be able to go online and enroll in Medicare, or go to your local Social Security office and request to enroll in Medicare. If you miss your window of opportunity to enroll initially, that would be the only time of year thereafter that you can enroll, unless you have some kind of special circumstance. But even when you enroll during that first quarter, your effective date for your Medicare Part B would be July 1st. So you could find, let's say somebody, if a client came to me in April of this year and missed their window of opportunity, we would have to wait till the following January to go online and enroll. And then the effective date wouldn't start till July 1. So there could be a significant consequence if you don't have other coverage during that time that's going to pay your bills. Lastly, the main consequence would be gaps in coverage, or not having full comprehensive coverage. Because for individual plans or self-employment plans, Medicare is primary when you turn 65. So if you don't have Medicare A and B, even if you retain that individual plan or that self-employment plan, it's going to sit secondary to Medicare. And if your claims get audited or looked at, or their system does an audit and recognizes that you're over age 65, when you have a claim, you would be responsible to pay the portion that Medicare would have paid, and the individual health plan that you have will only pay anything over and above what Medicare would have covered. And in many cases, Medicare pays 80% or more of the bills. So this would put you on the hook for a significant amount of money. Medicare A and B is nice baseline coverage for your health care, but many individuals also include secondary coverages. Secondary coverages may be Medicare supplements, Medicare Advantage plans, prescription drug plans, dental vision insurance. There's many different products and carriers, and they come along with different associated premium costs and coverages. When you first become eligible for Medicare Part B and enroll in Medicare Part B, you have a 6-month open enrollment window to get any Medicare supplement plan you want with no medical questions to qualify.